Hello, beautiful people. Welcome back to the channel. I hope everyone is doing well. I hope you're having a fantastic day so far. Hope your weekend is going great. In today's video, we're going to be talking about three quick positions that I wanted to share with you guys. These three positions are in coding. So if you are a medical coder, this is really the video for you. And these three positions are coding analyst type of roles, senior coder roles, as well as a compliance educator, but focusing on coding from a compliance perspective. So let's just dive right in very quickly. This position, as I mentioned before, the first one is titled Coding Compliance Educator as well as an auditor. This is a fully remote position, as you can see. This position has been open for a while. They do have multiple openings for this role. With this position, you need to have AHIMA coding credential like a RIA, RIT, or CCS to be eligible for this one. And the pay is $30 to $48 per hour. That is the compensation range. And with this position, you are going to be expected to work your typical Monday through Friday. You are entitled to all the benefits. It does come with the holiday benefits. You have the medical and vision. You have PTO. They give you about 12 days per year, which is not bad. And then you do accumulate as you become more of a seasoned employee. You also have HSA accounts, FSA, as well as other employee discount accounts as well that comes with just working for Conifer Health Solutions. So that is the first position. One thing I do like about Conifer in general, the application process is quite seamless. It's very easy, step by step, and also very intuitive. So there is really, it takes you through it very quickly. So you see on here, it talks about what the job summary is going to be like. You're going to be developing inpatient coding education courses as well as quizzes, including presenting live educational sessions, facilitating live Q&A calls, recording audio for education purposes. So because of the compliance component and the educator piece of this, you would be expected to help train other coders within the organization whenever there are new regulations around coding. This individual will be part of the team that will come up with the training for the rest of the coders and then present to them. So obviously based on that, it makes sense why some of the requirements they are expecting you to have knowledge of PowerPoint presentation, knowledge of other Microsoft products as well. So it makes a lot of sense. Education requirement, they want you to have an associate's degree in relevant preferred field or combination. They also want 5 years of inpatient coding experience. That makes sense, right? But that is more of a preferred qualification. So even if you don't have up to 5 years, you might still be eligible. They talk about 1 year of experience preparing and delivering education as it relates to audit findings or regulatory guidance for auditors. 3 years of coding compliance experience or ability to demonstrate an advanced level of coding compliance knowledge. So they are looking for you to have some knowledge around coding, especially specifically to compliance. And if you're a coder, everybody should have this, right? Because there are certain trainings or education requirements that you continue to meet as a coder. So that should, in some regard, be able to help cover that 3 years. But definitely look into that and let me know if you have any questions. The second position that I wanted to talk about is this one, also with Conifer, right? So this one is titled Inpatient Senior Coder, remote, fully remote, this position as well. This one came second on my list because it's slightly lower in salary than the first one. However, very similar, and this is a senior coder level role, so the expectation is a little bit more than the last one we're going to be covering. They're expecting you to have knowledge about DRG. DRG is a form of reimbursement. They are expecting you to have some understanding or proficiency around AHIMA compliance physician queries. You are expected to have like some EMR, so electronic medical records knowledge as well. So with this position, what exactly are the requirements? 1 to 3 years experience performing inpatient coding in acute care setting. A school diploma or GED, associate's or bachelor's degree in health information, nursing, or other related field is preferred, but it's not required. So even if you don't have an associate's degree or a bachelor's degree, you can potentially still be eligible to get this position. Years of coding experience would be considered in lieu of education requirements. So they're basically saying that though they really want people with associate's or bachelor's degree, but if you don't have that and you've been coding and working as a coder for many years, that should substitute for the associate's or bachelor's degree, which is a preference, by the way. But they're just calling that out. Required, they want you to have AHIMA as well, RIT or REAR, AAPC or CCS approved credential. So those are some of the expectations for this position. Yeah, that's about it. And the salary for this is 27 to $40 per hour. It does put on here, right? Must be able to travel nationally as needed, not to exceed 10%. So I wanted to call that out. And then it talks about the telecommuter policy, etc. But that comes with any telecommute job, because the expectation is for you to be able to work from home in a place that is not noisy, in a place where nothing is interfering with your job or with you being able to do the work. So that is really it. We're going to move on to the last opportunity, which is also with Kunifa. This one is also another coding job, and it is titled Coder Analyst. This is also fully remote. With this one, they want you to be able to perform diagnosis data submissions to clients. So this is a little bit different. You're doing more of the analysis component. And if you see, the requirements are slightly different. They are looking for AHIMA credentials or AAPC. That's still there. So that's typically just generic for every coding job. So if you are planning to become a medical coder, the first thing is to get as much knowledge as you can and then sit for the license so that you have that. So 3 to 5 years of experience performing medical record coding in acute setting, high school graduate or equivalent, and then they do have preferred, which is associates, very similar to the one we just went over, right? Or former coding classes completed. So this is the first time I'm seeing this one, right? So they are basically saying on here, if you've taken all the coding classes, you completed the courses and you passed, that is one that they will consider as well as being a preference in terms of education. So even if you don't have associate's or bachelor's degree, but let's say you've done the formal coding classes, they will consider those as relatively similar to having a bachelor's degree. And then obviously the license is always going to be there. Like I said before, that is still there. And the salary range for this is very similar to the one we just went over, which is 27.30 to 40.95 per hour. So those are still there. Possible position may be eligible for a sign-on bonus for qualified new hires, subject to employment status. So there's a sign-on bonus with this one, as well as the previous one, I believe. Yes, for the last two roles, the inpatient senior coder as well as the coder analyst, there are sign-on bonuses for both of those. So that's just a possibility for more money that you can use for whatever it is that your plans are at the moment. That's only going to help accomplish all of those. So really cool. So I wanted to bring that up so that you guys can know that that's something that is relevant to the last two positions. So those are the roles. So if you have any questions for me, come back, leave it in the comment section. Give this video a thumbs up. Subscribe to this channel if you've not subscribed already. Till next time, I wish you guys all the very best of luck, and I will catch you in the next one. Take care, guys. Bye bye.